What is your name? Where do you work? In which country? And maybe you can say one sentence about what's your involvement in community health.
Hi, I'm Dr. Stephen Markham. I work now as a research fellow at the University of Oxford in the UK, and I'm working on a social prescribing project to understand the role of link workers.
What is that, social prescribing?
So social prescribing is that primary care, the NHS, refer patients into social interventions such as Walking for Health interventions or men's sheds or community-based physical activity programs, items like that are able to support the health and well-being.
Okay, and thank you. And how is community health organized in your country?
That is a very good question. Community health, there is no kind of overarching strategy as such with regards to community health, I would say. There are some pockets of really good community health based work. A lot of that is run by voluntary sector organisations and by charities. There are some primary care organisations that fund community-based activities for people as well.
And is that labelled as such as community health, or is it under different labels?
It's often under different labels. There can be some proactive. People understand the idea of creating community-based interventions, but they're not necessarily called for the benefit of community health or called community health interventions.
Yeah. And I know that you are working on a project called men's sheds. Can you say a little bit about that?
Yeah, men's sheds are predominantly for men to attend. They are community-based organisations. They have a space and place which is specifically designed for men to engage in pragmatic utilitarian activities such as woodwork, metalwork, fixing electrical items, maybe doing work with leather, very kind of pragmatic based. And by men engaging in projects which look at woodwork, they learn skills from the other men that attend. They're able to teach other men some of the skills that they have. They pick up things, they gain in confidence, and some of the main aspects with regards to their health and well-being is that they're more social and that they increase their community networks as a result of engaging with men's sheds and meet people that they wouldn't otherwise have met.
And you say the project is still going, right?
Yes, so there's a number of men's sheds throughout the UK, around 600 in the UK as a whole. And that number is increasing as more men start their own groups, and also public health organisations or charities start to develop men's sheds for the benefit of men, and also of community health and benefit to female partners and to the wider community.
Thank you. Third question is what you have learned in the past few years about community health and resilience.
Well, one of the really interesting things around men's sheds in particular, I think one of the reasons that they've been so successful is that they're not advertised or portrayed as being a service for men. They hold group resources which men can then access, and men contribute. They are not a service user. They are not a client of a men's shed. The men come to men's sheds and they contribute their skills and their labour, and it's their choice to attend. There are no targets to meet with regards to the products that they need to have achieved, and it's kind of a health by stealth model. But health is not the primary goal from the point of view of the men attending. The men attend because they want to engage in those types of activities, and health is a subsidiary outcome. So the very nature that men are considered to be contributing to the organization or because they make items for social good. The very fact that they are contributing is seen as a positive element for them. Now they're also benefiting because their health and well-being does improve, their social health and well-being improves, they're gaining confidence, they have a purpose to their life by engaging in activities and by seeing other people. But the primary reason for attending is to engage in pragmatic activities and to enjoy those. So it's kind of a health by stealth model that they are benefiting by contributing.
Yeah, thank you. And what, in your view, what role can community health workers play to improve resilience in communities in times of crisis?
Well, I can't talk about kind of say psychological resilience, but in terms of groups, I think that ultimately what we need is more investment in infrastructure where people are able to come together for reasons other than commercial activities and things that involve, spending money or reasons to be together, which financially cost people. I think it's really important that we have community spaces that encourage people to come together and that enable our members, residents of areas to come together and to be a part and feel a part of their community and give them opportunities to contribute. And that's beneficial for them as individuals, and it's also good to contribute towards the community as a whole.
And you, as a next professional, what advice would you give to the future generation of community health workers?
A good question. I would start with the mantra that prevention is better than cure, and to really try to focus on primary prevention of keeping the well. So of preventing problems. Ways to prevent problems is to look at what human beings need in their lives in order to be healthy. So human beings are social beings. It benefits us as social beings to have opportunities to come together and to contribute skills, conversation, to learn from other people, and that we need more projects and more physical infrastructure to build spaces that enable us to come together.
Yeah. Okay. Thank you.